back to my channel. It's your girl Nurse Lee, and on my channel I talk about nursing, beauty, and lifestyle. So if you're new to my channel, please hit the subscribe button and the notification bell below so that you will be notified when I post my videos. So in today's video, I'm going to be talking about the topic of, should I become a nursing assistant before a registered nurse? I've been getting a lot of questions regarding that topic. People just asking me, people who are interested in the nursing field asking me, should they become a CNA or PCT before becoming a registered nurse? So if you're interested to know my opinion and my thoughts of whether or not you should become a CNA, which stands for Certified Nursing Assistant, or a PCT, which stands for Patient Care Technician, prior to becoming a registered nurse, then just keep watching. So in my opinion, I feel as though that it is beneficial to become a CNA or PCT prior to becoming a registered nurse. I just feel like it is wise to get a job that aligns with your ultimate career goal. I just feel like that makes things a lot more smooth in the long run and a lot more easier in the long run. And I'm going to tell you guys why I think it is beneficial to become a CNA prior to becoming a registered nurse. I'm just going to share with you guys my thoughts on why I think it is necessary to become that nursing assistant prior to being an actual registered nurse. So the first thing I want to point out is that when you become a CNA prior to becoming a registered nurse, you gain patients interaction. Like, you are able to communicate with patients and you're able to interact with patients prior to becoming a registered nurse. So that CNA experience enhances your communication skills when it comes to patient interaction. You're also able to have patient care, direct patient care. And what I mean by direct patient care is like helping patients with their ADLs, just helping them with their activities of daily living, just being able to have that direct patient care interaction really helps, when it comes to building your confidence with taking care of patients, because some people are hesitant when it comes to, when you're come straight out of nursing school with no nursing assistant background, you're more hesitant to work with patients, or I guess more afraid to work with patients, rather than if you already have that background because you were a CNA, then it's like, okay, I already know how to interact with patients. So that's a huge plus when it comes to becoming a CNA prior to a registered nurse. Another thing I want to point out is that you become familiar with equipments that are being used, whether you become a CNA or PCT in a hospital or rehab facility or assisted living facility. You become more familiar with the equipments that are being used in that facility, so that when you become an actual nurse and they ask you to hey, can you grab a Foley, or can you grab a IV starter kit, or can you grab just these different equipments that you use to care for your patients, or supplies that you use with your patients, you'll be more familiar with what the supply looks like, what the equipment looks like. You just familiarize yourself with what each thing looks like, which is beneficial to being a CNA or PCT prior. You also learn how to perform certain tasks when it comes to taking care of your patients. So, CNAs, they carry on a lot of roles that also carry on when you become an actual nurse. You learn how to perform certain tasks such as getting vital signs. CNAs and PCTs, the number one thing they do is to get a patient's vital signs. So temperature, their blood pressure, pulse ox, respirations. You get more familiarized as to how to perform that specific task. Something such as putting in a Foley. Some facilities allow their nursing assistants or PCTs to put in Foley, so you get more comfortable with knowing how to put in a Foley in both male and female. So just performing, that's just to name a few, just performing those type of tasks that will make you a little bit more comfortable when you become an actual nurse. It's like, I did this when I was a CNA, or I did this when I was a PCT. I've already familiarized myself with how to do that. So that's also a good thing when you become a CNA prior to becoming a nurse. Is like these tasks that you do as a nursing assistant, they carry on with you when you become an actual nurse. You could also, being a nursing assistant, you also work alongside other actual nurses that can help like build you up in terms of like helping you perform certain tasks, or even teaching you how to do things. So you building that rep towards working alongside actual nurses, you're also learning yourself from the nurses that you work with. Like, okay, when I become a nurse, I'll know how to do X, Y, Z because I worked alongside whichever specific nurse you decide to work alongside, and that nurse taught me how to do X, Y, Z. So that's a huge plus. It's like, all right, you're working in a facility, you're a nursing assistant, you work in a facility with other nurses, and you're trying to become a nurse as well. Like, it doesn't get any better than that because you're constantly learning from those nurses. And, some of the stuff you may learn is like, you can't give medications per se, but you can learn about the medications that they're administering to their patients. So certain medications or different medications that they're administering to their patients, you can always ask them questions as to what is that medication used for, what are the side effects, the interactions with that medication, and that hopefully if you work with generous nurses, which 9 times out of 10, that will be the case, they'll help and explain to you those type of medications. And not just medications, like other things such as like disease processes. Like if a patient has a certain disease process and you want to learn more about that disease process so that you'll be better prepared when you become a nurse, that's also a huge plus. It's like, okay, you're learning different disease processes while you're a nursing assistant, so that when you become an actual nurse, you'll know exactly what it is and how to treat that disease process. Being a nursing assistant, you also can observe how the nurses interact with doctors. You can see how the nurses communicate with doctors, see how the nurses communicate with family members, and then you yourself, you can also interact with family members as well, like learning and seeing how the nurses interact with the doctors and family members. And, you can also build a rapport with family members because it's like you've been working as a nursing assistant, taking care of patients, seeing different family members. So now you know how to communicate with those family members because of that nursing assistant experience that you've gained, so that when you become an actual nurse and it's time to communicate with family members, you're not frightened or you're not afraid, or you'll know what to say to those patients' family members. So I know that's something that takes time to build up, especially when it comes to communicating with family members, because you're taking care of their loved ones. So some family members, they don't take it easy with nurses or even nursing assistants. So just being able to communicate, building yourself up to build the courage to communicate with family members is also something that you can learn while you're a nursing student, or a nursing assistant, I should say. So think of it as like, as you're a nursing assistant or a PCT, think of it as though you are shadowing a nurse. If there's a really good nurse on your unit or in your facility that you really admire and you feel like is a really good nurse, just shadow that nurse, so that you can know what to expect when you become an actual nurse yourself. So those are a few of the pros when it comes to deciding whether or not you should become a CNA or PCT prior to becoming a registered nurse. I hope I've given you guys enough enough examples, you know, and reasons as to why you should become a CNA first before becoming a registered nurse. There's just so many benefits to that. And I myself, I was a CNA prior to becoming a registered nurse, and I will tell you that it really helped me out. It really helped me build my confidence, my courage to just do certain things that I feel like if I wasn't a CNA first, then and just jumped right into being a registered nurse, I would be kind of hesitant, afraid of doing certain things, which, I mean, there's nothing wrong with building yourself from there. It was just beneficial for me to become a CNA prior to a registered nurse. So if you get the opportunity to become a CNA or a PCT, then definitely take that opportunity. Don't let it pass you by. It'll really be helpful to you in the long run. And if you don't get that opportunity, then it's okay. Like, you know, if you're in nursing school, really utilize your clinical settings to, you know, build your courage or gain experience. Clinical settings, simulations, use those settings to help you out, but that just, you know, helps you familiarize yourself with everything I've mentioned, and it just helps you to become a little more comfortable with working in the healthcare setting. It just puts you at ease, you know, in certain situations. So I hope I've given you guys enough reasoning as to why I think it is important for you to become a CNA prior to becoming a registered nurse. If you found this video helpful, please give it a thumbs up. If you have any questions, comments, and or concerns, please leave them down in the comment box below. Don't forget to subscribe to my channel. Thank you so much for watching, and I'll see you all in my next video. Bye.